afternoon. Thought I would do a vlog real quick. Actually brought my brother Patrick to the dentist this afternoon because he's not driving right now, and so he just went in to get some work done, and I thought maybe I'd get on and do a really quick vlog. Let's see, I've been really sick for probably about a week. Everybody started with Brian, then me, then Sailor, then now the girls aren't feeling that great, but I don't know if it's hitting them as bad as it hit the other three of us, but I guess just a really, really bad cold or sinus infection. I don't know. Doesn't quite feel like the flu, but pretty bad. Some pretty rough stuff. So, I got to talk to the Dr. Richard Goldstein this week from, he's the clinical director of the research program that Hannah Kinney is a part of and runs, I believe, and it's the Sudden Unexplained Death in Pediatrics program, and I had about an hour and a half phone appointment with him on, was it Tuesday, I believe? Yeah, on Tuesday. And I don't know, it really was, I really enjoyed talking to him. It was very, he was very thorough in his questioning, very compassionate. He asked me, we started out by just asking me, or telling me what their program does, and they're there to not only do research as to why babies and children, just die unexpectedly, but they also are there to, I guess, be a source of comfort and source of support for families that go through these types of things. And so he wanted to know what I was looking, if I had any questions, and I basically told him I told him that I had just gone so long without having any questions ever answered that I didn't know if I had any questions really. I just want someone to maybe make me feel a little bit better and maybe find out if it was something that was genetic. Not that would make me feel better, but so that I would know. I don't know. I just am thankful that they're looking further into my babies, into their deaths. So he asked me about the babies, what type of babies they were. Asked me about the pregnancies with them. Asked me what type of medications I might have been on while I was pregnant. Asked me, I'm trying to think. I told him that, Tess had like a little heart murmur. She was a really fussy baby and very clingy. She was, I don't know, it was very strange. He asked me, questions about her, and I couldn't remember. It was kind of sad. Couldn't remember certain things, but she had pretty bad reflux and had an upper GI just a few days before she died and was prescribed some Zantac, and I told him that. We talked about Jones. Jones was not fussy, really. Was a really good baby, really strong baby, but when he was born with a very weird breathing hiccup. And was in the NICU because his lungs weren't developed for about a week, maybe a little bit over a week. I can't remember exactly. So we talked about that. They're very interested in the history of my family and my babies having large heads. I guess that is something that they're looking into now. They think there might be a correlation between large heads, babies with large heads, and SIDS. And my babies definitely have large heads. So he asked me, how do you know that your babies have large heads? And I said, well, because, or that your children do. And I said, well, my 8-year-old has to get like an extra large men's bike helmet. I said, my 2-year-old just got a cap from his papa, that came back from a trip, and it's a men's cap and it fits him. And he was like, oh, okay. And We talked a little bit about the shape of Jones's head, how it was similar to Scarlett's, but all of them had big heads. Theirs was they just had, those two had the prominent foreheads, and they both had a little bit of a some misshapen spots in the back. Scarlett still does. Anyway, they're very interested in, and Dr. Kitty is very interested. Whenever I first told her that, it was like a light bulb kind of went off with her. She's like, oh wow, that's one of the things we're studying right now, is large heads in babies and SIDS. So they're very interested in that. We talked about the circumstances of their deaths, which I don't mind going over, but you know, after all of it was said and done, it was kind of it was a bit draining, I guess. But we also went back 3 generations on both sides of our families and talked about any type of illness that, you know, as a cluster, you know, like, is there anybody on it as a cluster, like, do any of my parents' siblings have something? Do any of my parents' siblings, children as a cluster, do they struggle with any sort of, disorders with seizures or heart disease or, so he was very thorough. We went, down, and I've actually found out that, I guess on Brian's father's side of the family, his father had a cousin that